we're here at Transforme, your guys' company that you created. I'm here with Dr. Bouganim and Dr. Mustafa. Would you guys like to introduce yourself and tell us about Transforme? What is it?
I'll let you start. I give you the honors.
Well, Transforme is it's an idea that we had where we wanted to make orthodontics more accessible. Mm-hmm. And so we saw the different parts of orthodontics that weren't accessible for everyday people. And now, Steve and I, we grew up, we never had orthodontics growing up. Mm-hmm. So a huge barrier of that was price. And we wanted to make sure that our orthodontics is affordable for everyone. Because we feel that a great smile is no longer just a luxury. It's something that everybody needs to succeed in life. And so one part of the accessibility is having treatment that's more affordable. The second part is having access through minimal appointments. So allowing our patients to come in only when necessary and trying to streamline most processes.
So is that how the costs are reduced? Through fewer visitations and things like that? How do you guys make it so affordable?
And that is a great question because it really gets at the heart of the plan, of the business plan that we put together with this. We're trying to create orthodontics that is affordable for everybody, so we need to reduce our costs. And part of doing that is to streamline processes. What you'll notice about our orthodontic clinic that is different than other orthodontic clinics is that we have we only use aligners. So we don't have braces, we don't have wires, we don't have other things that create extra inventory. So that's one way where we streamline our costs. Other ways are where we try to maximize the efficiency of the treatments. So if we can get you in and out of orthodontics as quickly as possible, you'd be happy, and we get savings, and we pass those savings on to you.
Okay, so it's not only affordable for the patients, but it's also beneficial for their time and things like that. So speaking about aligners and braces, what's the benefit of aligners over braces?
Both of them work really well.
Do you want to answer this one?
Well, it's just this is a question that's good for me.
Okay, amazing. Okay, great. Okay, so
The other questions I could have done, but this one.
it's okay. We'll
really
get back to
specific
you.
to
We'll
me.
get back to you.
Both braces and aligners work very well to move teeth.
Okay.
Now, certain bites are better suited towards braces and certain bites are better suited towards aligners. The benefit of having an orthodontist be able to diagnose your bite is that as an orthodontist, when I assess the bite, that is one of the things that I assess. That if aligners are suitable for this type of bites. And so the first thing you'll want to find out is whether you're a candidate for our treatment or not. Once you're a candidate and aligners are useful for you, well then, as I mentioned earlier, both aligners and braces are able to get you the smile that you want. They just work differently, and each has their pros and cons. We happen to like aligners and the way they're able to line up patients' teeth with minimal oral hygiene implications, with minimal emergencies for the patient to need to take time off of work or come out of school to come to the orthodontic clinic, with minimal inhibition with regards to extracurriculars. If you're playing any wind instrument, or if you're playing contact sports, not having it bother your lips and your cheeks. So there's all sorts of benefits that we feel that we want to relay onto the patients, and that's why we decided to do it this way.
Yeah, one thing that I see oftentimes as a general dentist when I have a patient come in, especially younger kids that have braces, they have a really hard time cleaning them. Those little metal boxes that are on the teeth. And even our hygienists, our dental hygienists, that's what they do is they do hygiene all day. And as soon as somebody comes in with braces, it's just so difficult. And a lot of times you'll see that the gums are just so swollen from how difficult it is to clean. And sometimes what we'll see is after the orthodontist finally removes the braces, we'll see like cavities that are formed around the boxes because that's such a hard time cleaning.
Yeah.
So a lot of times I end up telling the patients it's like you're gonna have beautiful teeth, but they're gonna have lots of cavities. So you need to watch out. Make sure you clean really, really well. And it's just so hard.
And for eating food, right? Like you
Oh, yeah.
can't eat a lot of foods. I had braces before, and I had to restrain on some of my favorite foods. But if I did aligners,
You wouldn't have to restrain from any of those.
Exactly. And I heard that you guys do self-assessments at home. So this is a new thing. Can you explain what that is and how beneficial it is?
Yeah, so to take the example that Stephen just mentioned with regards to oral hygiene, another way that we invest in the oral hygiene is being able to take those home scans. And what they are is a series of pictures that provide the orthodontist, myself.
I think she's talking about the assessment.
Oh.
That was the question, right? Assessment
Yeah.
from home.
Oh,
The
okay.
initial assessment that you do.
Okay. Then that is
So
something
good.
different. Would you like to go ahead?
I mean, I could.
Yeah,
Okay,
go.
so
Okay,
tell
sure.
me about. I heard that Transform does at-home self-assessments.
Yes,
Can you
we do.
explain what that is and how it
Yes.
benefits the patient?
So the home assessment that we do basically allows you to, from the comfort of your home, you take a few pictures and you send it to us, and then we go through a thorough analysis of that, and we compile kind of like what we see that's going on and what we feel would be the right price, and it gives you an idea of the treatment plan. And it really allows us to kind of assess it, but it's considered an initial assessment. Okay. But it really gives you some good information that allows you to kind of take a decision.
Okay.
So we identified a potential barrier for orthodontics. And one of them is that sometimes if a parent comes in to the orthodontist and wants to get a quote, well, they get the quote and sometimes they can't afford it.
Mhm.
And it can be quite embarrassing for the parent in front of their child not to be able to do that orthodontic treatment because they can't afford it.
Imagine your dentist tells you have to do an orthodontic assessment because your child's teeth are it looks like he'll need ortho.
Okay.
They go to the orthodontist, and then the orthodontist says it'll be $12,000 for your treatment, and that parent can't afford $12,000. And the orthodontist says right in front of the child, he really, really needs this, or else he's gonna have lots of problems. And then it just becomes very embarrassing, right?
Yeah.
So that's like the scenario that we see played out often.
And yeah, that is quite frequent. A lot of people can't afford orthodontics. So I know a lot of friends that didn't get treatment because they couldn't afford it. So this is very amazing
Yeah.
what you guys are doing.
So this self-assessment allows the patients to bypass that embarrassment, because as you mentioned, from the comfort of their home, they're able to get an idea of what the price is and get an idea of what potentially will be needed, and then they can make their decision before coming in, and that way it removes a lot of those barriers of the embarrassment that we were talking about.
And it minimizes them having to take time out of their day to travel to a clinic, and as well just I feel like a lot of people also get anxiety about coming into orthodontics or the dentist or places like that. So doing it at the comfort of your own home is very nice.
Yeah, sometimes people hear like orthodontist and they're right away they're like, I'll never be able to, I wouldn't even be able to afford that. I don't even want to think about it.
Yeah.
You know? So what's nice with this is, again, with just a couple pictures, and that's free, the assessment. In 2 minutes, I mean, it takes you 2 minutes, but it takes us quite a bit of time. It takes us about a day or two to really analyze your case. We'll give you a price, and it costs you nothing to figure it out.
Yeah, that's great.
Yeah.
And it's accessible on your
On our website.
On the website.
Get started, you click get started, and that's it.
Great.
Yeah.
Cool. And would you like to expand? I heard this company is all about new technology. How are you implementing new technology into your orthodontic treatments and systems and stuff like that?
So we're firm believers that technology never replaces any professional opinions or professional service. You'll still be seen by an orthodontist. You'll still get FaceTime with your orthodontist. However, technology can very much facilitate everything and make it more effective. And by making it more effective, it makes treatment time shorter. It makes outcomes better.
Mm-hmm.
Some of the technology that we invest in is having 3D scanners, state-of-the-art 3D scanners that allow us to show the patients exactly what the patient's teeth look like, how they will look like at the end of treatment before they even start.
Wow.
Show them within their face how their teeth will look at the end of treatment so that they can scroll before and after. Provide them detailed reports on what is going on with their teeth. Having scanners that they could take with them at home so that we can evaluate what their teeth look like on a weekly basis. And providing them with digital aligners that the aligners will be able to move the teeth in a very convenient and hygienic way.
Okay. And so, who are possible candidates to be patients at Transforme?
It's a great question. If you want to find out, you go onto our website, snap a few photos, and we'll let you know if you're a candidate or not.
Yeah.
Amazing.
But also, to add to that, technically the Association of Orthodontics, the American Association of Orthodontics, recommends that at the age of 7, you should go and get your orthodontic assessment. So from the age of 7, a lot of people don't realize that we can figure that out. At 7 years old, you'll have 2 of your adult teeth will come out right here, right? And then we do like an analysis based off of those 2 teeth. We can, thanks to like a bunch of studies that have helped us identify the different sizes of the teeth. Just with those first 2 teeth that come out, we can have an idea of what size your teeth will be and how much room we need. Am I saying this correctly? You're the expert. But,
yeah, you're absolutely right. So the adult teeth, we can extrapolate and find out how much space concern there is through the teeth as well as through the jaws. Just having an idea of what the jaws look like. All of that information is processed, and we let you know if your kid is good to wait or if we should intervene early. We always feel that if things will get better with time, you should give it more time. We don't like to be overly aggressive in treating things. However, in certain situations where we notice things are going to get worse with time, then it's very beneficial to start early and to get things when they're still relatively simple and relatively fixable.
do you want to hear an example?
Sure. Give us
What's an example of a 7-year-old or an 8-year-old that could have a problem that's like, oh my God, we should probably fix this right away?
The most common one that we see is narrow palates.
Yeah.
So a kid comes in, has a very, very narrow upper jaw.
Mm-hmm.
And that could cause a whole host of issues, one of which is that the adult teeth that need to grow in don't have enough space. So what needs to happen at a very early age is to widen that jaw, because what happens is by the age of 8 years old, the jaw is actually not going to be growing much more than that.
Okay.
And that's what people don't always know, is that they see the kid at 8 years old and they think they're fairly small and they see them grow their whole body. But the face actually stops growing quite early, especially the upper jaw and especially the width of the upper jaw. It stops growing one of the earliest things. So we have a very good idea, even at the age of 8, what it would look like at the end. So if it looks narrow, it's not going to grow any more than that. Now, if we leave that and we wait until all the adult teeth grow in, well, then you can have a whole host of issues in terms of teeth getting stuck in the jaw because they don't have enough space to grow in, or growing in an inappropriate position. The final thing is trying to create space. You're then forced to either remove teeth or do a surgery to widen the jaw, which involves breaking the jaw open and widening it. Yeah. So it becomes a lot more difficult when at a young age, it's a fairly simple fix.
Narrow palate, that's usually from pacifier?
It can be from pacifier. It can be from a whole bunch of. Some of it is genetic. Some of it is using a pacifier or sucking on your thumb, or having a low tongue posture, or breathing more through your mouth. Or there's a whole slew of etiologies or reasons why this would happen. But at the end of the day, we are seeing it more and more commonly in children nowadays.
Okay.
I thought he was going to say posterior crossbite, but it was narrow palate.
Yeah.
Also, since Transform was just created and it's introducing these new innovative ways to do orthodontic treatment, what are some misconceptions that you think people will have about your company, your treatment, that you might want to clarify?
That's a good question.
Yeah,
I can think of one already.
go for it.
How is your treatment so cheap?
Yeah.
How is the price so low? We've already heard that one.
Yeah.
Which almost made us like, we should just raise our prices because people are thinking that like what we're doing is it's too cheap. But then we thought about it and we're like, no, that would go against what we're trying to do and make orthodontics accessible. And we're like, no, we got to stick to our guns. It's got to stay low. We want to help people. We want to make a difference, right?
Yeah. That is one of the most common questions that we get, and really there isn't a one-word answer to it. It really involves a whole bunch of things that we do to allow us to practice and provide treatment at a very low cost. Part of it is the technology we use. Part of it is the efficiencies. Part of it is the streamlining. Part of it is the locations that we choose. A whole host of things that together, when you put them together, it allows us to offer the costing that we do. One thing that's important to note, though, is that we never undercut quality.
Mm-hmm.
That is something that is very, very important to us. So we want to make sure that the quality of the digital technologies that we use is the best in the business. The quality of the aligners that we use is the best in the business. The quality of the clinicians we use is the best in the business. The quality of the hygienists that we employ, everyone, they're all very well trained and the best in the business. We don't cut corners when it comes to quality, and that's because we stand by our work. We believe that what we're doing is very good work. We just don't need to charge that much because our costs are less.
Speaking of quality, what does this mean? Can you explain this? I know you would never do this, so that's why I had to be like, I'll go grab it.
What does this? I don't even know what this means.
What
Does this mean? Top 1%
I made him
Invisalign provider.
So we have a little video on the homepage. I don't know if you saw, with him going like this. I was like, Mustafa, you have to do this. Because Mustafa's from Alberta. I don't know if you know his story.
I'm not sure.
Well, I grew up in Montreal, so I did a little stint in Alberta.
Okay, yes.
That's where I went to school.
He was there for like 10 years now?
Yeah. And when I went to school there, I ended up practicing. I opened a few clinics over there. And I always was interested in aligners and always was interested in providing my patients with treatment using aligners, which led to this.
Amazing.
Yeah.
That's great.
Yeah, so this was from his time over there, and this is what he's bringing with him. All of his knowledge and his expertise. So how do you get this? What does this mean?
It means you've done a lot of cases with aligners. So it means that you
I'm very qualified.
you have a little bit of experience. Yeah.
So is this like top 1% in Canada? I know you're too humble to really say it, but I'm gonna push it out of him.
Say it. What is
This
it?
is top 1% in what? In
Top 1%.
Quebec?
I don't know. We'd have to ask the company.
Okay. All right.
Okay. And
I put you on the
So-
spot there. I'm sorry.
Let's say I know that every patient has a different case with their teeth. So I'm assuming the duration of the treatment depends on the individual's teeth.
Yeah.
And stuff like that. But usually, how does an aligner treatment, how is it structured?
So we have 4 basic tiers
Okay.
for our treatments. We have the early treatments,
Okay.
and then once that's usually the cases that have baby teeth in their mouth. Then once you have all of your adult teeth, it can be either a simple case, a level 1, or a level 2, which is moderately difficult, or a level 3, which is a difficult case.
Okay.
And it's very simple and very well delineated. So when you get your assessment or when you come in for your consultation, we let you know where your case stands.
And usually, on average, how long should a patient expect to have Invisalign?
Good question.
For our simple cases, we anticipate about 6 to 8 months of treatment time. For our level 2 cases, we anticipate about 12 to 14 months, so slightly over a year. And then for the difficult cases, they're anything above 18 months, so a year and a half.
Yeah. Also, something we decided to do with our website is we wanted to make sure that it's transparent our pricing. So all our prices, the prices for those 4 levels can be found on the website.
Okay.
You click on it, you go there, and you'll see them.
Okay.
So it's not like you come in and figure it out. It's really, it's there. It's there.
And I know aligners are way more common now, but for people who don't know how aligners work, what attachments are, can you just explain the gist of how it works?
So an aligner, what it does is it hugs the tooth. And each aligner moves the tooth ever so slightly until the last aligner places the teeth exactly where we want them.
Mhm.
When doing that, sometimes the teeth slip out of the aligner, the plastic. So what you need sometimes is a little extra grip. And that's where those attachments come in. They provide extra grip to hold onto the tooth so that when you're trying to move it in a specific direction, it's able to move more predictably.
I also think the use of aligners over braces can boost a lot of teenagers' confidence. I know people of any age can use aligners, but usually people that I know in most cases get them right when they're entering high school, during that awkward phase. Nobody wants to smile with their mouth open when they have braces, stuff like that. And aligners are completely clear, and you can take them out, so you don't have to worry about that. That's great.
That's right.
Why do kids? So I see a lot of kids with braces.
Yeah.
A lot of adults with clear aligners. Why do we see kids with braces more often than aligners? I know that now aligners they work perfectly for kids too, right?
Yeah.
So why is that?
Most of the parents that I talk to that want, let's say, braces, it's because they feel that their kids, they don't want to nag their kids to wear their aligners, or so they want something glued onto their teeth so they can forget about it. Most of the adults feel like they don't want anything glued onto their teeth because they want the flexibility of being able to remove the aligners and eat whatever they want, brush their teeth. So that's where that initial disparity comes from. Now, in my experience, what I find, my best patients are always in the 7 to 9, 10-year-old range. Those are the best patients. And the reason is because their lives are so regimented. They eat at a specific time, usually during recess, and then at lunchtime, and then at dinner. And they're used to taking orders from adults. So they're very comfortable with you telling them you need to do this, and then they do it. Right? And they're surprisingly resilient. They follow rules. Adults, on the other hand, can be a little more challenging because they love to snack, and they also have other habits that they do that warrants them removing their aligners more often.
And so they forget to wear their aligners. And it affects their treatment.
Exactly.
Yeah.
So I actually find the opposite, even though most people would think that it doesn't really work with kids are actually ideal candidates. And
Amazing.
I have very little trouble with them wearing their
That's
aligners.
why, okay. Because I've heard him say, kids are easier to deal with than adults sometimes.
Yeah.
Right?
Yeah.
Now I get it.
You got it. Okay. Well, if you think that you're a possible candidate to become a patient at Transforme, go to the Transforme website. You can do your at-home self-assessment video, or you can do your at-home self-assessment pictures, send it in, and they will get back to you.
Yeah.
Okay. Thank you, guys.
Happy to treat them.
Woo!